Hi everyone, Dr. Arthur Plesa here, founder of Knee-Chest Specific Chiropractic Certification Seminars. Today, we're going to do a brief overview of chiropractic spinal thermography. Spinal thermography is a type of chiropractic instrumentation. It's used to measure the neurological components of a vertebral subluxation, namely pressure and interference. In other words, it allows the chiropractor to determine whether that misalignment seen on X-ray is sufficient enough to cause nerve pressure and interference to nerve flow. The nervous system is an electrically hot system with a byproduct of heat. This was conclusively proved through the research of Dr. George Crile and published in his book, A Bipolar Theory of Living Processes. Heat radiates outward from the spinal nerves, heating surrounding tissues, including the skin. Normal nerve flow from the brain to the body without interference will result in balanced paraspinal skin temperature. This is the temperature measured by spinal thermography. Subluxation causes heat to emit from the affected spinal nerve at the point of interference. Since this is a unilateral pressure upon the spinal cord, we're going to see a temperature differential develop from one side of the spine to the other. A subluxation temperature differential remains more or less constant throughout the day, only varying in its intensity. This, in turn, will create a heat pattern along the sides of the spine that is present every time the patient's subluxation is present. Spinal thermography lets a chiropractor know when an adjustment is clinically necessary. It does this by directly measuring a subluxation at its source. Spinal thermography also confirms where to adjust. By scanning over misalignment seen on an X-ray, the chiropractor is able to confirm if that misalignment is actually sufficient enough to cause nerve pressure and interference to nerve flow. With all the different chiropractic techniques available, have you ever wondered which ones are the most efficient at correcting the neurological components of a subluxation? Well, with spinal thermography, this is made possible. A chiropractor can use any technique, adjust a subluxation, and then check it immediately after to confirm whether nerve pressure was cleared or not. Subsequent visits will determine whether that adjustment stayed in place. The efficiency of any technique has its value in being able to correct the subluxation and keep it in alignment for the longest period of time. This is only made possible with spinal thermography.